right, so we are going to go ahead. We have many questions that have been posed both currently throughout this presentation, and we also have the many questions that were submitted prior to the beginning of the presentation.
You know, if you're feeling any symptoms, you don't think that something is normal. Some of the symptoms of COVID, a little shortness of breath is very common as you get later in pregnancy. But any question you have about any of these issues, you should call your primary provider. So whoever your obstetrician, your midwife, whoever you see on a regular basis, like I said, the offices are open. We want to hear from you. If there's anything that makes you a little more nervous than normal, there's no problem picking up the phone, calling the office, and we're happy to talk you through it. And if we think you need COVID testing, because that's a concern, we can order that testing and get that done for you.
For our moms who are tested and they test negative, it's normal routine postpartum care. You know, it's our desire to keep moms and babies together. So in those cases, our babies and mothers room in together in the room on our postpartum floor. And with our moms who test positive for COVID, like we had kind of mentioned earlier, is that, you know, we do follow the recommendations of the CDC, which is to separate. But with that said, you know, we do continue with the shared decision-making model. And so we will present you with, you know, what the recommendations are that we have, and then we'll talk to you about kind of what your wishes are. And then we will formulate, you know, a plan together as a team so that we can make a plan for you and your baby and your caregiver that, you know, meets everyone's needs.
We're testing all patients on arrival for childbirth. So this would also be patients who have cesarean deliveries that are scheduled. When they come for their pre-op appointment the day before, we're doing the testing at that time. Otherwise, when patients are coming in labor or for their inductions, we're testing them then. It's a nasopharyngeal swab. So it's a swab that goes into the back of your nose, and it's done by a nurse or your doctor or midwife. That test gets sent to our laboratory, and our turnaround time is generally within an hour, sometimes 2 hours, but it's anywhere from 30 minutes to 2 hours. We get the results back very quickly.
One of the important questions that families ask themselves as they get ready to plan for a birth is, where do I feel the most safe? And that's a question that each individual family is going to answer. And many people are going to choose that they want to be in the hospital for their birth. And if your choice throughout your pregnancy has been to plan for a hospital birth, the hospital is the right place for you to go. Your risk of contracting COVID when you come into the hospital to give birth is very, very low. And you're also walking into an environment where you're still going to be supported. You'll have your familiar care team and have those elements of your labor and your birth that you were seeking to begin with.
We are encouraging breastfeeding for all new moms, even if you have COVID. So the good news is we have not seen the virus in breast milk yet. Obviously, we're very early in the pandemic and learning about COVID, but it doesn't seem to be a way that this virus is spread. So that's good news for new moms who choose to breastfeed.
We hope that this is all temporary. I think that there might be changes that go on for a while. We might be wearing masks for more of the care that we give throughout the summer and throughout the fall. And that might change permanently forever. We don't know what that will be like, but hopefully the changes that are permanent will be smaller changes. People should know, though, that we're tracking it almost weekly. And the things that we've taken away, we want to give back just as soon as possible. And we'll do that by tracking things so closely.